Hello viewers, my name is Bancrafti. My YouTube channel is Bancrafti's Lecture. You can share and subscribe. So today's my topic is the disease Filariasis, Elephantiasis, the most dangerous disease. It is the infection. This filariasis or elephantiasis is the infection with the filarial worms. It is an infection with the filarial worms. The causative organism or agent of this disease, filariasis, elephantiasis or wuchereria Bancrafti. This is the causative agent, causative organism of this dangerous disease, filariasis, or we call it the elephantiasis. So the causative organism, it is commonly called the filarial worm. It is commonly called the filarial worm. Belongs to the phylum Nematode. Found in the limb vessels and limb nodes of the man. Primary host is the man, especially of lower limbs, where the developing stage called the microfilary. And are found in the saliva of mosquitoes like the Culicus mosquito or vector secondary or vector host. So the life history of filarial worm is digenetic. It is digenetic, have two hosts. So the life history of the filarial worm is digenetic. It is viviparous worm, and it is the tropical infection, helminthic disease, where parasitus lives inside the limb vessels. So it is the endoparasite. Inside the limb vessels, connective tissues, often causing obstruction, blockage causes the obstruction or blockage of but the young one migrate to blood vessels for being picked up by mosquitoes to turn them into the infective form filar thread-like. It is quite common in warm countries. In warm countries means ज़्यादा ये पाया जाता है. The disease is caused, I already told, by Nematode, wuchereria Bancrafti, and so it is caused by the wuchereria Bancrafti. It is quite common in warm countries. I have already told you that sexes are separate and male is shorter and this posterior end is recurved. If we go for life cycle of this parasite, copulation occurs in the limb ducts. Afterwards, female give birth to small larvae called the microfilariae. So during night, these microfilariae leave limb ducts and reach the superficial blood vessels. When a female Culicus sucks blood of the infected person, it is important when this female Culicus mosquito sucks the blood of infected person, it takes microfilariae in crop. These microfilariae penetrate wall of the crop and reaches the thoracic muscles, where they undergo ground and molting form. Here they pass intercellular glands and proboscis. When the infected colecus bites, this colecus bites a healthy person, it introduces microfilariae in his blood. They leave blood stream and reaches the lymph ductus where they grow into the adults. Thus, in this case, colecus acts as the vector. If you go for the incubation period of the human beings, incubation period of this disease, filariasis, elephantiasis, incubation period is 5 to 18 months. 5 to 18 months. It is the incubation period of filariasis, or we call it the elephantiasis. If you go for transmission mode, how this disease transferred from one person to another person, how this disease spread, we call it the transmission mode. Transmission mode of this disease, filariasis, elephantiasis. The parasite is female Culicus mosquito is the vector. Female Culicus mosquito is the vector. The parasite is transmitted to humans through a bite of an infected mosquito and develop into an adult worm in the lymphatic vessels, causing severe damage and swelling. We call it the lymphoderma, elephantiasis. In a painful, disfiguring swelling of leg, and a leg get more swell, and genital organs. The pathogen is separate from one human being to another human being through a mosquito bite, through a mosquito bite, like Culicus, through a mosquito bite, like Culicus. The pathogen is separate one human being to another human being through a mosquito, like Culicus. It is passes some stage of its life cycle in mosquitoes. It is important. It is passes some stage of its life in the mosquitoes. The parasite resides in the lymph vessels, connective tissues, and mesentery. It is thread-like and shows sexual dimorphism. The interior end is swollen. The female has size 8 to 10 centimeter. The female has size to 8 to 10 centimeter, and the male has 2.5 to 5 centimeter. Ovulation occurs inside the lymph glands. This copulation occurs inside the lymph glands and vessels. It produces thiostates. It produces thiostates, juveniles or the microfilariae. They possess one interior V-support representing excretive system. Size is hardly 2.5 mm. 2.5 mm. And long, 2.5 mm long. Microfilariae enter the blood vessels and reaches the skin area during night. For being picked up by female mosquito, microfilariae are transferred. They are transferred into third stage, which is also infective stage. The infective parasite are deposited near the site of mosquito bite, and they pass through the punctured skin and reaches the lymphatic vessel of the lower limbs or the major situs of their residence, are the major signs of their disease. If you go for symptoms of this disease, you all know symptoms of the filariasis or elephantiasis. Symptoms of this disease are, it causes filarial fever. It causes filarial fever and mental depression, headache, heavy infection blocks the lymphatic vessels. It blocks the lymphatic vessels and causes enormous swelling of certain body parts. Swelling of certain body parts. For example, legs, we get leg swelling, scrotal sacs, breast inflammation, breast swelling due to the blockage of the lymph vessels. When blockage of lymph vessels of lower limbs occur, then swelling occurs in legs. These look like legs of elephants. These occur in legs, these look like legs of elephants. So it is also called the elephantiasis. It is also called the elephantiasis. It may also cause deformities of the genital organ. If you go to the control measures of disease, how we control this disease, how we give the preventive measures of this disease, control. You all know that prevention is better than cure. Prevention is better than treatment. Prevention major controls with eradication of the mosquitoes. And we should remove the mosquito in the nearby areas and their breathing places and finish their breathing place. And use of mosquito nets and creams to keep mosquito away. And use the spray insecticides so that the mosquito cannot near to your body. If you go for treatment of this disease, filariasis, elephantiasis, there is no proper treatment yet known. But to somehow disease can be cured in the initial stage, like most common used drugs are anti-helminthial drugs, Hetrazane is the drug, and diethyl carbamazine is the drug. Diethyl carbamazine, DEC, we call it. And also, second treatment is reconstruction of the affected body parts through surgery, and we cope this disease. So, dear students, this was the most dangerous disease which I described: filariasis, elephantiasis. Cause to add them is wuchereria Bancrafti, and their incubation period, transmission mode, symptoms, control, prevention measures, and treatment. So, dear students, rest is okay. Thank you all.